Now is a good time to raise our awareness about breast cancer as a subject. And we have questions like, what is metastatic breast cancer? How can it be treated? Who's most at risk? This morning, Dr. Denise Yardley, who is the Assistant Director of Breast Cancer Research with Sarah Cannon Research Institute, and Dr. Sue Friedman, a breast cancer survivor and the Executive Director of the organization called FORCE. Good morning, ladies.
Good morning. Good morning.
Thank you so much for being with us. This information is big, it's vast and expansive, and it's a hard subject to kind of get our minds around. So, Dr. Yardley, let me begin with you with a definition, if you will, of metastatic breast cancer and who is most at risk.
So metastatic breast cancer really defines the presence of breast cancer that is in a distant site from the breast, that is liver, lung, or bone. It most commonly occurs later after the initial diagnosis of breast cancer by months to years. And about 10% can present with breast cancer at the very initial diagnosis that's already spread beyond the breast. I think the most important message about that is that metastatic breast cancer is treatable but not curable. And so we look at ways of making decisions about treatment and what the important treatment decisions are focusing on. And one such important endpoint for metastatic breast cancer is overall survival. And so we look at treatments that really can extend the patient's survival to hopefully embrace new treatments and even potentially a cure.
Well, talk to us a bit about extending the quality of life for the people who have metastatic breast cancer.
So when we look at treatment options, and I think we always encourage shared decision-making with the patient and their healthcare provider, we look at a host of different treatment opportunities and try to make selections on which one is the next best fit. Median overall survival, such as with Kisqali, which is shown in 3 randomized large trials, median overall survival advantage, extending that now beyond 5 years, and partnering it, the fact that it's an oral medication that can be taken in the convenience of home, and looking at the quality of life or the side effect profile. So for Kisqali, we see a transient lowering of the white blood cell count, maybe some nausea, vomiting, constipation, or diarrhea. We see some fatigue, a little hair thinning, maybe a rash, all that's easily adjustable with some adjustments to the dosing. So it allows the patient to be able to partner this pill with their anti-estrogen therapy, take it in the convenience of home, and expect to have great quality of life, and furthermore, have an extension of their life beyond 5 years.
Thank you so much, Dr. Yardley. Now, Sue, let me turn to you. We only have about a minute left, and I do want to know about your organization and what inspired you to start it.
Oh, well, thank you. So I was diagnosed with breast cancer at age 33, and it was really shocking. I didn't expect it. I didn't have a family history, although I did learn that I have an inherited mutation in my BRCA2 gene. And so, after my diagnosis, I learned I had to advocate for myself, and that made me want to help others know which questions to ask and how to get the information they need to make informed decisions. So our website is facingourrisk.org.
Well, and so people can have some of those questions answered. Is it interactive, Sue?
Yes.
Okay. And Dr. Yardley, can you send our viewers to a website where they can learn more about treatment?
Sure. So they can look at specifically about Kisqali at www.kisqali.com. They can look at breastcancer.org or cancernetwork.com or cancer.net as options. And of course, facingourrisk.org is a great website as well.
Thank you so much for sharing all of this important information with my audience. Thanks.
Thank you.
And we'll be back with more local lifestyles right after this.